When we experience OCD, our thoughts and fears create a very convincing reality about what might go wrong, the kind of person we might actually be, or what we might be capable of doing. That it's no wonder why we feel so compelled to try and stop it by performing rituals. But we know that these time-consuming rituals bring only temporary relief, and the burden of holding all that responsibility is really scary. But when it comes to treatment, selecting the right psychological therapy for you doesn't have to be scary. Good news is that cognitive behavioural therapy is highly effective for treating OCD. They reckon 75% of people with OCD experience significant improvement, and some NHS services report recovery rates of up to 80%. That's pretty impressive, right? As a CBT therapist, what I find most scary is when people say they've had CBT, but when they describe the work they've done, I can't recognise it. Worst of all, they've poured their money and energy into it, and it hasn't worked. In fact, many times it's made it a lot worse. And this makes me feel incredibly cross. So I want to help you to understand what treatments are available, recognise what good therapy looks like, and know which treatments are NICE recommended and which are evidence-based, so that you can make the right decision on which will work best for you. So we're going to talk about traditional CBT approaches like exposure and response prevention and cognitive therapy adapted for OCD, but also look at two approaches that are not provided in NHS talking therapy services at the moment, but are gaining evidence and traction in the psychotherapy world. These are acceptance and commitment therapy and inference-based CBT. Here goes. Number 1, exposure and response prevention, or ERP. It's based on the idea that an intrusive thought or image, whilst very normal, that is, they happen to all of us, in someone with OCD, they trigger an anxiety response. And because performing a ritual takes away the anxiety, it means you're more likely to do it again. Coupled with the fear of what might happen if we don't perform a ritual, the mind and body make performing those rituals pretty compelling, no matter the cost to other parts of your life. So ERP treatment will help you to grade and gradually face the fears you have while holding off on your rituals. And when you do this in a certain way, your body's anxiety response gradually gets less and less until eventually we achieve our aim of fear extinction. This essentially means that 1, when those natural thoughts or images come up, they no longer cause you and your body excessive distress and anxiety or affect how you behave. And number 2, it's when you learn that you can cope with those difficult emotions. Number 2, cognitive therapy. Now this focuses instead on exploring your beliefs that have formed in connection to OCD. And it's based on this assumption that it's a dysfunction in the way that we think that maintains the OCD. So treatment targets faulty cognitions to change our behaviour. How does it do this? Well, in the same way a scientist might conduct experiments to learn the outcome, cognitive therapy will help you conduct behavioural experiments to test out your beliefs. For example, about the kind of person you really are, or about what might actually happen if you don't perform a compulsion. Essentially, the aim of it is to learn what happens when you don't check or perform your rituals. Number 3, acceptance and commitment therapy, or ACT. Now, ACT is very much from the behavioural therapy family, but unlike CBT, its main aim isn't primarily to get rid of the intense feelings associated with OCD, but to accept them. But more often than not, in doing so, people often feel better. Now, it supports you to do this by helping you to develop psychological flexibility. For example, by diffusing from unhelpful thoughts, feelings, urges and images, and create more space and maneuverability to enable you to commit to more workable behaviours. That is, behaviours that are more aligned with what you value most in life. Number 4, the relative newcomer to the OCD treatments bouncing out of the late 90s is inference-based CBT. Now, ICBT points out to us that OCD begins with doubt, and everything that comes afterwards, what we fear might happen, anxiety, our rituals, they happen as a result of the doubt. Now, the doubt is maintained and stirred up by a narrative that's personal to you, and this is your OCD story. It's made really convincing because it's built upon all the conclusions or inferences your mind makes, but these are all based on possibility rather than reality. And as we know, anything is possible. This is called inferential confusion. ICBT addresses the process of doubting by understanding and breaking down these inferences that we make and returning to trusting the senses, which results in less distress and can give us more power to choose how we behave. So which one to choose? Well, here's the thing. NICE says that adults with OCD should be offered psychological treatment that includes ERP. And for those who refuse or can't engage with treatment that includes ERP, individual cognitive therapy, specifically adapted for OCD, may be considered. But our clients do occasionally ask for alternatives to traditional CBT approaches, having found them maybe too difficult or just not as effective as what they'd hoped. Well, I'd say ACT and ICBT approaches are promising. Why aren't they recommended? Well, when the NICE guidance was published in 2005 and reviewed in 2010, there was a lack of evidence about ICBT. There was more evidence about ACT, but still not enough. Since then, there has been loads more research that suggests they do effectively reduce OCD symptoms. But remember, NICE are also concerned about value for money. So what we really need is more evidence that compares these newer approaches to the more traditional CBT approaches to demonstrate whether they work as well or indeed even better and are just as cost effective. The bottom line is that all of these treatments are options that may be worth considering and exploring if you're considering treatment for OCD. If you want to find out more or book in for a free consultation, contact us today at getcbt.co.uk.